Bangladesh's worst measles outbreak in decades has killed hundreds of children, with families struggling to meet the rising cost of treatment. Details in this report.
Bangladesh is battling its deadliest measles outbreak in decades. Since mid-March, at least 844 children have died, while more than 112,000 people have sought hospital treatment. Health officials say the preventable disease is placing severe pressure on hospitals and imposing a heavy financial burden on thousands of families. For many parents, the biggest challenge is finding enough money to keep their children in hospital as treatment costs continue to rise.
The financial burden begins with hiring or arranging an ambulance. At first, hospital officials suggested admitting my child to the ICU, but we couldn't do that because there were no beds available. So we had to admit our child to the HDU, where I spent around $1,000.
Families say the outbreak has forced them into difficult financial decisions, while many have witnessed the devastating impact of the disease firsthand.
We really struggled to manage the cost of the treatment. If our child had only had pneumonia, we wouldn't have had to spend so much money. I have witnessed the deaths of many children due to measles here. It's unbearable to see a child with a cannula, experiencing convulsions and breathing difficulties.
Doctors say the outbreak is beginning to ease, but warn that stronger vaccination coverage and better nutrition remain essential to prevent further deaths.
In the current situation, children are still dying from severe cases of measles. But if we can achieve herd immunity and combat malnutrition, then we will be able to control not just measles, but other infectious diseases too.
Health authorities say reducing measles cases will depend on achieving higher vaccination coverage and improving child nutrition. They warn that without stronger immunity, children will remain vulnerable to measles and other infectious diseases.